Hi, everybody. I'm Dr. Kavitha Manjunath, one of the clinical head at Portea here. Today is World Hypertension Day. The objective of this day or today's talk is to communicate to you the importance of hypertension and its serious medical complications, and to provide you information on prevention, detection, and treatment. Since 2006, World Hypertension League has dedicated this day, May 17th of every year, as World Hypertension Day. Some of us have access to good medical care, but many of them with hypertension are not lucky as others for good medical care. Hypertension is one of world's silent killer, but it doesn't have to be, as it is within our reach to detect, to prevent, to diagnose, and then to treat. Yes, hypertension is called the silent killer, as it gradually increases in the body, due to which there is development of various complications, various cardiovascular disorders such as myocardial infarction, the so called heart attack, arrhythmia, irregular heart rhythms, stroke, and heart failure. It gives no warning or symptoms or signs whatsoever. This COVID-19 pandemic has reminded us that life is frightened and health is the most precious commodity on earth. That's why action on hypertension is more important than ever. So, working together, we will be able to help everybody live longer with healthier lives. And the vision for this year, the theme for this World Hypertension Day, is to measure your blood pressure accurately, control it, live longer, and focus on focus on the low awareness rates worldwide, combating it more so on accurate blood pressure measurement methods. People with hypertension are at an increased risk of severe disease and death. 9 out of 10 people who have hypertension don't have it under control. And 2 in 5 people who have a hypertension are not aware that they have it. So, more than a billion people have hypertension. About 1 in 4 for 4 men and 1 in 5 women, over a billion of people have this condition. The burden of hypertension is felt disproportionately in the low and middle income countries, so where two-thirds of these cases are found, and largely due to increased risk factors, especially the behavioral risk factors in these population in the recent decades. Hypertension is not only leading cause for preventable deaths worldwide, it's also a number one reversible cause of death, and it kills more people than any other condition, than any other infectious diseases combined. You see, every 20 millimeter rise in blood pressure doubles the vascular mortality in young adults and in those aged between 35 to 70 years of age. BP, blood pressure control, can save lives than any other primary care interventions, and it is the single most important thing the healthcare facility can do for the people. Hypertension is also known as raised blood pressure or high blood pressure. This is a condition in which the blood vessels actually have a persistently increased pressure within them. Blood is carried from the heart to all parts of the body through the blood vessels. Each time the heart beats, it pumps blood into blood vessels, and blood pressure is created by the force by by the blood against the walls of these blood vessels as it is pumped by the heart. Now, higher the pressure, the harder it is for the heart to pump the blood. So, hypertension is a serious medical condition and can increase the risk of developing heart diseases, brain diseases, kidney, stroke, and death. It is a major cause of premature death worldwide. Now, coming to risk factors, there are modifiable and non modifiable risk factors. Modifiable risk factors include unhealthy diets like excessive salt consumption, a diet high in saturated fats, trans fats, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. Non modifiable risk factors include a family history of having hypertension, age over 65 years, and coexisting other diseases like diabetes, kidney disease, high cholesterol, etc. Hypertension can also cause strokes by blocking or bursting arteries that supply blood and oxygen to brain, as well as kidney damage, which can lead to kidney failure. High blood pressure causes damage to heart by hardening the arteries and decreasing the flow of blood and oxygen to the heart. So too many people died too young from cardiovascular diseases, especially from cardiac arrhythmias, that is, irregular heart rates, irregular heart rhythms, mainly because of delayed, incomplete, and interactive treatment of hypertension. And at the same time, we are seeing increased behavioral risk factors such as physical inactivity, unhealthy diet with excess salt, excess fat, excess trans fat, high sugars, and high use of alcohol. Now, evidence have shown us and accumulated knowledge from countries with different studies have identified three big hurdles in BP control, and the hurdles are in diagnosis, treatment, and continuity of care. There is limited awareness, underdiagnosis, and lack of access to healthcare services, especially in rural areas. So these have been the major hurdles in diagnosis of you know hypertension. Signs of hypertension. Most people with hypertension do not experience any symptoms. Very high blood pressures can cause headache, nosebleeds, chest pain, breathing difficulty. So, very high blood pressures, people with blood pressure of about 180 by 120 or higher can experience symptoms like chest pain, breathing difficulty, anxiety, palpitations, confusion, nosebleeds, severe headache, buzzing in the ears, dizziness, nausea, vomiting, etc. So, if you experience any of these symptoms and having high blood pressure, seek immediate medical care. Most people with hypertension do not notice symptoms and they may be unaware that they have this problem. So, checking your blood pressure is the best way to know if you have high blood pressure. If hypertension isn't treated, it can cause serious health complications, various other diseases like cardiovascular disease, stroke, arrhythmias, including death. Having blood pressure measured is quick and is a painless test. So individuals can measure blood pressure at home using automated devices. Also, an evaluation by an healthcare professional is important for assessment of risk and associated conditions. Management and prevention of hypertension. Lifestyle changes can help prevent blood pressure, prevent hypertension, and also lower the blood pressure. Lifestyle changes like eating a healthy diet with low salt diet low in saturated fats or trans fats, losing weight, being physically active, quitting tobacco, reduce the consumption of alcohol. So, by modifying or reducing these modifiable risk factors will help prevent hypertension. But there are also non-modifiable risk factors which we discussed in the previous slides. Now, those with family history of hypertension or aged over 65 years, and those with coexisting diseases like diabetes and kidney disease, in them, avoiding dietary and behavioral risk factors is doubly important especially in those with non-modifiable risk factors to help lower the blood pressure or prevent hypertension. Hypertension can also be managed by reducing and managing mental stress, regularly checking blood pressure and consulting health professionals. Treating high blood pressure and managing other medical conditions is also important. Now, if you have high blood pressure, your doctor may recommend one or more medicines. So, your recommended blood pressure goal may depend upon what other associated conditions you suffer from or you're diagnosed with. Some of the do's and don'ts which could help in your daily life to lower your blood pressure or to prevent hypertension. Do's: do eat more vegetables and fruits, sit less, that is, be more physically active, which could include walking, running, swimming, dancing, or activities that build strength like lifting weights. Get at least 150 minutes of moderate to intensity aerobic activities every week or 75 minutes per week of vigorous aerobic activities. Do strength building exercises 2 or more days each week. Lose weight if you're overweight or obese. Take medicines as prescribed by your healthcare professional, and please have a regular follow up on your blood pressure. Keep appointments with your healthcare professional on time. Don'ts: some of the don'ts: do not eat too much salty food, avoid diets which are high in salt, avoid foods high in saturated fats and trans fat, quit tobacco, quit smoking, reduce the consumption of alcohol. Do not miss on your blood pressure medications, and do not share the similar medicines with other hypertensive patients. If you have high blood pressure, your doctor may recommend one or more medicines. You are recommended Your recommended blood pressure goal may depend on what other associated medical conditions you suffer from. So generally, the blood pressure goal is less than 130/80 if you have cardiovascular disease, that is heart disease or stroke, if you have diabetes, chronic kidney disease, and if you're at a high risk of developing cardiovascular diseases. The ideal blood pressure goal can vary with age and health conditions, particularly if you're older than 65 years of age. For most people, the goal is to have blood pressure less than 140/90. So your doctor may ask you to, regularly check your blood pressure at home. Home monitoring of blood pressure is a good way to keep a track of your blood pressure values, and this will help you to understand, if the medicines are helping you out control the blood pressure. It will also help the doctor know if your medicine is working or if your condition is going worse, and if they have to plan a drug modifications to help you control blood pressure. So monitoring of blood pressure regularly at home is the best way to monitor blood pressure, diagnose hypertension, and also prevent complications. There are several common antihypertensive medications to reduce or lower blood pressure. Just give you some basic idea of these medications, and I will not get into detail of it. Some of them are like water pills, also called diuretics. They actually eliminate excess water from your body and help lower blood pressure. Then we have angiotensin converting enzyme inhibitors called AC inhibitors, angiotensin 2 receptor blockers, ARPs. They actually relax the blood vessels and help lower the blood pressure and prevent kidney damages. Calcium channel blockers also help relax blood vessels and help lower blood pressure. There are various other medications also, but these are given based upon your blood pressures if not controlled with these primary medications, and they also depend based on associated various other medical conditions which you suffer from. Uh, just updating you on some of the complications of undiagnosed hypertension or uncontrolled hypertension. Among all the complications which has been mentioned earlier, hypertension can cause serious damage to heart. Excessive pressure can harden the arteries. It can decrease the flow of blood and oxygen to the heart. So, this elevated pressure and reduced blood flow can lead to chest pain called angina. It can lead to heart attack, where the blood supply to the heart is blocked. The heart muscles die due to lack of oxygen, and longer the time the blood supply is blocked, greater the damage to the heart muscles. Heart failure, when heart is unable to pump blood to various other vital organs. And finally, irregular heart rhythms, also called arrhythmias. There is a strong link, evidence which has been studied between development of arrhythmias and uncontrolled hypertension or undiagnosed high blood pressure. Now, arrhythmias refer to abnormal heart rhythms, including irregular heart rates, fast or slow heartbeats. Now, this can lead to sudden death. Now, arrhythmias can arise from either the atrial chambers or the ventricular chambers of the heart, and they can lead to symptoms like palpitations, dizziness, chest pain, and even stroke or sudden cardiac arrest. There are several studies which have shown or evidenced a strong link between hypertension and arrhythmias, hypertension and cardiovascular diseases. Now, hypertension is a significant risk factor for development of arrhythmias. The underlying mechanism is, the chronic persistently high blood pressure. This leads to a structural and an electrical remodeling in the heart. So hypertension induced changes, they impact the heart's normal electrical conduction pathways, promoting arrhythmia initiations and perpetuation. How do we prevent this is by effective management of hypertension, which will in turn help reduce the risk of arrhythmias. Blood pressure control significantly decreases the incidence of arrhythmias and other associated complications, and thereby help control it. People live longer and combat complications of high blood pressure. Early detection, regular monitoring of blood pressure, regular monitoring of heart rhythms is a key for management of hypertension and to reduce the risk of hypertension associated complications. Now, for detection of arrhythmias, uh, ECG, electrocardiogram, monitoring of heart electrical conduction, monitoring of heart rate, heart rhythms is very essential. And we have automated devices which can help detect the the various heart rhythms and heart rates, and this can help early detection of arrhythmias and help early referral and management of hypertensive related complications. Thank you.
Thank you, Dr. Kavitha. Thanks a lot, for a very insightful and very crisp, summary of hypertension, right, on this World Hypertension Day. Let me just share my screen and then I'll just pick up from where Dr. Kavitha left, right? So, yeah, everyone is able to see my screen. Dr. Kavitha, can you confirm?
Yeah, we can see your screen.
Great, fantastic. So, we've learned a bit about hypertension, the silent pandemic that is there, the incidence and prevalence that is there. Most of the time going undetected, undiagnosed till actually it flares up, and by that time it has already led to significant damage to our most vital internal organs. So, yes, hypertension, I would say, is a party pooper, right? We don't want to miss our heartbeat for the wrong reasons. Means I would love to miss a heartbeat, for some Bollywood heroines or some, some beautiful scenery, but not because of hypertension. So Dr. Kavitha, mentioned about the arrhythmias and how hypertension could be one of the reasons that can lead to abnormal cardiac rhythm, right? And there's a strong link. But if we are missing our heartbeat, right, for the wrong reason or for the party pooper called hypertension, why is it important, right? What can abnormal, heart rhythm lead to, right? So if we just look at the complications that abnormal heartbeat or arrhythmias can cause, including serious problems like stroke, heart failure, and sudden cardiac death, right? It becomes imperative that if we have to prevent these life-threatening, conditions to happen to us or to our loved ones, we need to see that how we are able to early detect and do a timely intervention and prevent complications and improve outcomes, right? So we also need to see that how we are able to not only detect early, we are able to prevent, diagnose, but then also see that we are able to, look at the treatment, right, and reduce the symptoms, improve the overall quality of life in case we have already developed this, complication, and ensure that we are able to manage, reverse, or prevent this from happening, right? And also it is very important that, yes, I've seen some questions come in that, I've missed a beat, what does it mean? I think what is also important is that we are able to take a holistic approach to this, where we are able to do some risk stratification, right? We are able to look at your history, your family history, your comorbid conditions. We are able to look at your lifestyle. Then we are able to look at the parameters, including your hypertension. We are able to then do some diagnosis to see, are you at risk, high risk, very high risk of arrhythmias or abnormal cardiac rhythm. So, it becomes very important if we want to see that, yes, we do not develop these life-threatening conditions or these episodes, then how can we actually detect these arrhythmias or abnormal cardiac rhythm in the most convenient manner? And that is where, we want to just link this to, as technology is growing in every sphere, right? I think health tech is no behind. And now using smart devices, using integrated technology, using integrated services, we are able to revolutionize personal heart health monitoring, right? And that is what I'll just briefly talk about in the subsequent slides, right? So what are the indications? We've traditionally seen that, for our parents or for our, near or dear ones, if anyone has had a chance to, go and, see that an ECG has to be done, right? The cumbersome process that is there, including the whole experience, which may not be very pleasant or comfortable, right? So what are the indications where we do need a convenient way of monitoring the heart rhythm through an ECG, right? And it could be a preventive setup where we have a family history, or it could be especially post-COVID, where I want to monitor my health proactively, right? Especially post-COVID, we have seen cases, of sudden cardiac deaths happening. Young people in their 20s, early 30s, early 40s, just collapsing, and then the cause of death is, massive heart attack or heart rhythm abnormalities, right? So how can I take a preventive approach by being able to remotely or, personally being able to, as a point of care device, record my ECG? Then there are a set of patients who know that they have the disease, but every time going to the hospital or to the clinic to get an ECG done is cumbersome, is ineffective, right? And it may actually add to the complications or symptoms of the patient. So how can I actually have a convenient way where I am able to manage my health effectively? I'm able to investigate these, symptoms, which when I'm in a clinic, they may not lead to anything, but when I'm at home under certain circumstances, I may have palpitations, I may feel that I'm missing a beat, right? I may have some chest pain and then syncope. If I can actually, have a device, a point of care device where I can monitor my BP accurately, I can effectively monitor and record my ECG, I think I'm able to better diagnose and manage my disease. And then, of course, once you are there for the medical professionals also, I want to see what is the outcome of the treatment I'm getting. So evaluation of arrhythmia treatment. I want to see that, yes, there are certain high risk patients who have some underlying, heart diseases, which may predispose them to either stroke or to arrhythmias, how can I actually screen those and see that yes, they already have not developed that complication? Or in case I may have some patients where I want to recommend that yes, as a physician, I would like to have my patient being remotely monitored. So here unveiling that what I have really been very impressed by. This is the device. This is the actual device. It's less than the size of Amazon Fire Stick, right? And this has revolutionized how we can remotely monitor, right? And to all the cases that we mentioned in terms of preventive care, or managing treatment, we can use this point of care device to save lives. So this is a live course, cardiomobile 6-lead, right? It's an FDA approved medical grade for detecting arrhythmias. And no longer we have to go through that cumbersome process of going to a clinic, and the whole process, which is very unpleasant in many cases, especially for females. How can I actually use this point of care device for screening, for management, follow-up remotely? So that's what it is. And we've been using this device, and it has shown fantastic results and has saved lives. And again, similarly, the BP apparatus, traditionally we have seen you need a stethoscope, you need that mercury, the BP apparatus that is there. So how technology is enabling that we are able to have these user-friendly devices, layman-friendly devices, which can help us longitudinally measure any recording. A BP recording, as experts say, that a single BP recording has no value. Right? I should be able to see longitudinally over different times of the day, over different times of your mental status, that what your blood pressure is like. Then I'm able to see whether either you have that disease, or whether that disease is managed effectively, or how I can prevent and reverse that disease. Right? So Omron, the world leader in these devices, has these smart BP machines which can be integrated to the technology platform, and every data is digitally recorded. I don't need to maintain charts, I don't need to maintain papers. Everything can be digitally stored directly onto a platform, a technology platform, and we can have this data which we can actually use for regular monitoring. And without frequent clinic visits, we can be more accurate. We can use it to track longitudinally what the implication of things are. We can do risk stratification, right? And we can do an alerting system which can be then and trigger an alert to your either family members, or trigger an alert to your physician. So that is how the ecosystem is coming together in terms of these smart devices which are enabling monitoring, screening, management, and helping to save lives of the complications developing from hypertension. So I'll just share a live case. So I'm Dr. Rahul Verma from NanoHealth. We are into preventing hospitalization, and we have been using these point of care devices to ensure corporate wellness. This is an actual study in the last 6 months of 3 corporates. We are using this device in the office. You can imagine the impact of it. We could actually detect that 2% of the people have atrial fibrillation, and there were 10% of the employees with an average age of less than 35. Right? So that's what some of the questions coming on the chat are also, that especially post-COVID, we see a lot of these undiagnosed, non-symptomatic, right, or ignored cases which need to be caught using these convenient point of care devices, and then of course put into a care cycle where then the confirmation of the diagnosis or further follow-up can happen. Right? I don't need to have everyone go to the cardiologist to have the TMT and the ecos. We should be able to screen effectively, and once diagnosed, then of course the specialist ecosystem is triggered, the care ecosystem is triggered by the technology, where then the confirmation happens, follow-up test happens, and then care is provided, and with the key players coming all together to ensure we are able to save lives. And again, for hypertension, using Omron devices, this is a very interesting case study of one of the leading fintech companies, where we saw that 1 in 3 employees actually had high blood pressure, right, with average age of less than 28 years. Right, the whole management was shocked, and then of course now they are trying to see how they can more proactively intervene to prevent these lives from these young people to be able to manage their health better, so that 5 years down, 10 years down, it is not that they are actually developing complications, including arrhythmias, including other complications of hypertension. So, this is how convenient it is, how the ecosystem comes together in terms of the smart devices, in terms of a smart technology platform like NanoHealth, to be able to do risk stratification, and the services provider, which gives a holistic approach to care, to diagnosis, to preventive health, and be able to manage the disease better. Great, right? So what is important for us to also understand, whatever age we are, so let's not go by what is the picture here, but 99% of the time, the heart patients are on their own. It could be at home, elderly, or we could be in office, or we could be somewhere else. It could be of any age, right? So how can we actually draw out a cardiac care plan which is backed by state-of-the-art devices, cutting edge artificial intelligence enabled technology for doing risk stratification, for doing managed care in an effective manner, and supported by service from health professionals, from healthcare professionals, at home, at the convenience of home. Because it is very critical for us to see that we are not only able to effectively manage and monitor cardiac health, but we are able to prevent premature deaths. We are able to prevent hospitalization. Right. With that, I would like to raise the curtain on the three the transformative or disruptive solution which we are launching and introducing a groundbreaking program that revolutionizes cardiac care, including doctor consultations, personalized diet and exercise guidance, medical report reviews, medical reminders, diagnostic testing, having integrated smart devices like cardio mobile, homegrown BP devices, all of them integrated into the state-of-the-art AI-enabled platform and app for you to take charge of your heart health, right? So get ready to experience comprehensive care from the comfort of your home like never before. This is the first of its kind in the world. So please stay tuned for the big launch of the Heart Smart program. So I'll pause here and we can get into questions. Is this okay? And Dr. Kavitha, you there?
Yeah, I'm there, Dr. Rahul. Glad to take up questions here.
Yes, I'll just read out the questions if that is okay. Right? I think some of them you have already answered, but let's for the benefit of everyone, I will just read them aloud, right? So the first one is, which type of exercise is good for hypertension management? This is a question from Vijay. Thanks a lot, Vijay, for putting the question. And others on the call, please continue to ask questions. We'll try to answer as many as we can in the next 21 minutes that we have for this. Yeah. Yes, Dr. Kavitha, you just want to answer that?
Sure. Yeah, I've just answered it in the chat box, but for the others who have joined late, right, I can tell you the best exercise, for anybody is a brisk walk of at least 30 minutes daily. You can do it twice daily. 30 minutes is the best exercise to control your blood pressure. Also, it's a good for your heart health. You can also do, swimming, running, some of moderate intensity aerobic activities, as explained, at least 150 minutes per week, 75 minutes each day.
Great.
Okay, that's the maximum one.
Fantastic. I think very effective, very short, and yes, it can transform you. Thank you, Dr. Kavitha. So next question, I think is from Lata. In case of resistant hypertension, what are the recommended strategies for further evaluation and management?
Sure. Now, Lata, we call it resistant hypertension when somebody's blood pressure is not controlled by using of 2 or 3 medications. Okay, then that means to say, the medications are working and there could be some underlying cause which is causing this resistant hypertension. There are multiple causes for resistant hypertension. It could be obstructive sleep apnea, kidney related, renal artery stenosis. So it needs a detailed workup, a detailed clinical check to understand the cause, and then treating the cause is most important. So if it's somebody with resistant hypertension, I would suggest please get a proper check, clinical check from your doctor, and doctor will advise you a few workups to understand the underlying etiology. That's the best way to go ahead in resistant hypertension. And we have treatments even for resistant hypertension. Once it's diagnosed, we'll be able to take care of it too.
Great. I think a follow-up of the same question, Dr. Kavitha, is, it's a question from Ravi. Are there any emerging therapies or treatment approaches for hypertension that show promise in clinical trials or research?
Treatment of hypertension has been happening since many, many decades, Ravi. And it naturally, absolutely, we have promising approaches. People have controlled their blood pressure, complications have been prevented. So your question, are you talking about resistant hypertension or a normal hypertension, the primary hypertension, which everybody develops?
So I think let's
Ravi,
assume
are you there?
either let's Dr. Kavitha, let's assume that because resistant hypertension we've already talked about. So let's assume the other and then answer that, right? Because two-way chat probably unmuting may not be
maybe that's an issue.
Yeah.
So if you're talking about primary or secondary hypertension, yes, there are promising clinical trials, and that's into use, and we are all into that clinical practice based upon these evidence-based research treatments.
Great, thank you. Very interesting from Avinash. What is the reason if I feel there is a skip of a beat sometimes? Sorry, I started my webinar that we should not miss our beat for the wrong reason, right? But Avinash, yeah, we will try to answer that. So Dr. Kavitha.
Yeah, skipping beats, heartbeats, if you really feel it, we need to confirm it. We need to hear to your heart, do an auscultation, and ECG will be an best method to actually check if you have skipped any heartbeat accurately. Maybe your feeling may not be what you feel, a skip of a heartbeat may not be a real one, but we need to confirmation is very much necessary. But there are multiple reasons, but I may not tell you that you have this reason, just giving you certain reasons. If you have had some blocked arteries, the blood vessels which supply the heart, if those are blocked, or high blood pressure. And now we have this coronary, as Dr. Rahul explained, COVID, post-COVID cardiac complications. There are reasons for the skipped heartbeat. Heart structure, change in heart structure due to hypertension, cardiomyopathy. So there are various reasons which we will have to underlying disorders, like thyroid disease or diabetes. All these could also be a reason. So this requires a proper clinical check and an ECG recording to confirm if you really have a skipped beat.
Thank you, Dr. Kavitha, for that comprehensive answer. Very interesting question from BL Ajit. These days, at a young age group, I feel chest pain frequently. Does it also relate to hypertension? I think it is linked to the answer, but if you can briefly answer it, I think that would help. Yeah.
May or may not be, Ajit. But if we have to exactly tell you, so the chest pain can be due to a superficial structures of your chest. It can also be the reason due to underlying, chest structures. The underlying structures could be the lung, heart, the superficial structures, the bones, the rib cage, the muscles. So we need to first actually differentiate from where are you getting this chest pain? Is it in heart related, lung related, or is it your musculoskeletal system related? So that's why my answer could be may or may not be. So checking you, a direct clinical check, getting an ECG is very important to understand the reason.
Great. I think Lata has asked again the second question from her. So, and point on, which was the essence of this webinar, is home ECG monitoring accurate? Shouldn't we be concerned about home cardiac management? Thanks, Lata, for that question. Yeah.
do you want to take up or should I go ahead?
Yeah,
Dr.
you please
Rahul?
start, Dr. Kavitha.
Yeah,
I
sure.
think, yes.
Yeah. Yeah, Lata, we have been pioneers at home ECG monitoring at Portea. Most of our elders, patient, 90% of them are getting ECG done at home. And we get this readings over our smartphones, automated devices. We, we look at the recordings, we diagnose, we talk to the patient, and we are able to report them. And then, when required, immediate referral diagnosis happens, and it has turned out accurate. It is accurate, and it has been in use since many years.
Great. Yes, I think, again, just adding to what Dr. Kavitha mentioned, this is an FDA approved. This has been thoroughly researched, in the Mayo Clinic and in US and in India. We are actually using this device now, also building a lot of registries, which we can use for training the AI. But it is very effective, right? So I've seen the results, and there are a lot of studies which we can share, which is available on our Alive course website as well. But driving the point home again that yes, this is accurate, right? This is medical grade. This is FDA approved. There's a question again, Lata, is this product expensive? So, Dr. Vida, if you can allow me to answer that, right?
Sure.
So there are two ways in which I can answer this question. One is, how do you value your life, right? And how do we value the cost of preventive health, right? With a lot of studies saying that, actually preventive health cost is 1/100th the cost of secondary or tertiary health cost. So if you are able to prevent any complication from developing, if you are able to screen and effectively manage early, then the cost of that is 1/100th of the cost of you ending up with a complication and being referred to a secondary or a tertiary or to a hospital, center for care. That is one way to look at it. The second is, if you look at the complete integrated package of this device, which comes with the technology platform, comes with managed services, I think it is very, very attractive. And, we will disclose the price of the program as we go into full launch of HeartSmart. Okay. Question from Ravi. Are there any resources or support groups available for individuals with hypertension who are managing their conditions at home?
Yeah. So you want me to take it up? Yeah. Yes, sure. Yeah, Ravi, we have been managing Ravi, we have been managing hypertensive patients at home. We have a team here, Shubrit, who will actually, she can put the toll-free number in the chat box, the email where you can contact and ask for home managing of hypertensive adults. Okay, you can contact them and you can ask that, if any one of you or your loved ones are suffering from high blood pressure, you can ask for home doctor consultations, home ECG monitoring. And with this, we will be able to handle your blood pressure and help you keep it under control and for a good monitoring. Great. Shubrit? Shubrit, are you there? I think I'll ask her to put up in the chat, the mail and the contact number where you can contact them.
Fantastic. So I think that there is a question from Lata. Are there any alternate or complementary therapies that may be beneficial for hypertension and cardiac care at home? You would like to take that, Dr. Kavitha?
Yeah, sure. Are there any alternative or complementary therapies that may be beneficial for hypertension and cardiac care at home? Complementary alternative therapy, let me speak, I'm an allopathic doctor. Talking about other alternative therapies may not be under my purview, but definitely certain home remedies or, these exercises are beneficial in the primary prevention stage, primordial stage, and for primary interventions. But when you're into secondary or tertiary interventions, I think there is a necessity for certain medications. Alternate therapy, complementary therapies may not help when you have already entered into the second stage or the third stage. Maybe this will be effective in the pre-primordial or in the primary prevention of hypertension.
Great, thanks, Dr. Kavitha. Question from Rajiv, a very good question. Does this model work effectively for a vast majority who may not be so tech savvy to use smart devices, but are equally at risk. So Rajiv, if we just look at the smartphone penetration, and if you just look at, as an example, it may be oversimplifying the way how we use WhatsApp, right? So most of us are able to use WhatsApp. Most of our parents are able to use WhatsApp. That is the simplicity of this platform. That is the simplicity of this device. That is the simplicity of this solution. I think that is the benchmark that all of us here have set, that see, it has to be patient friendly, it has to be effective, and it has to be very, very simple for anyone to use, especially if we look at, there is a segment of target users which we want to actually have an impact on and be able to better manage, which are elderly, which are people above 60, which are above people above 70 or so. So that is why, once we've, uncovered the full solution, you will see the simplicity of it and the beauty and the impact of it. So question from Divya, are there any specific preventive measures or lifestyle changes that grandparents can adopt to reduce their risk of heart disease? So very nice question, Divya. So I'll let Dr. Kavitha answer, but then I can add from my side. Yeah.
Yeah, sure. There are a lot of preventive measures and lifestyle changes, Divya. But now, if you're talking about your grandparents, and I'm sure they are above 65 and 70, we will need to first understand their heart status presently. Are they in a preventive stage? Or are they into already developed a hypertensive heart disease or not? So based on that, if they've all, if their whole life they had not had any blood pressure, high blood pressure, or the heart condition is good, definitely there are preventive and lifestyle changes to prevent development of blood pressure in their age and also prevent heart-related complications.
Yes, and then of course, these devices can help you monitor, right, and feel assured that yes, things are under control, right? So that's what I would say. Question from Balu: is there any device without taking blood for diabetic detection? Nice information provided, and thank you both of you. So thanks Balu for the compliment. But I'll have Dr. Kavitha mention about, is there any device where we can detect diabetes without taking blood?
Is there any device without taking blood for diabetic detection? Oh, okay. Right now, I don't think, of my knowledge, it is into the market right now. They're in still clinical trials. I think phase 2 and phase 3 clinical trials are yet to be done. And not yet into market right now, as per my knowledge. Dr. Rahul, if you have any information, you can share it with us.
Yes, no, I think there means a lot of trials happening. There are a lot of devices out there which have built AI tools, which just based on like you were measuring your blood oxygen levels, like the pulse oximeter, they're able to measure your blood glucose, right? Or looking at your eyes or looking at your face, but none of them has been approved medical grade so far. Right, so that is where we are. Of course, technology advancing leaps and bounds every day. We'll see if one day we have a solution where these continuous glucose monitors, which still have to be embedded, are slightly invasive. Things like that can become point of care devices for patients to be able to monitor, detect, screen, manage their blood glucose levels. Yeah, there's a question from Anshul. I was just reading through. It's very interesting. And for first time diagnosed patients, I think that this is something which comes first to their mind. That is it possible that young people developing hypertension took medicine for some time and now they're off medication, or the baseline medication is must for rest of their life? So I think the question is, if you once start taking medicine, can you come off it or not? So Dr. Kavitha, yeah.
Yeah, it all depends upon, the monitoring services, the monitoring values, Anshul, how well they have been managed with the medications. And then requires a proper trial to slowly taper the medicines and then check for BP control. If tapering the medicines and still your BP is under control, then slowly we can, there are chances to stop the medication and not necessary to continue for the rest of the life. But even after we stop the medication, you need to be under regular follow-up, monitor your blood pressure regularly, monitor your heart condition regularly. That's important.
Yes. So I think I'll just add to that, Anshu, that, if we are proactive, right, and we are able to screen longitudinally in a very convenient and managed, on a managed platform, I think we can, come off medicines, because these are lifestyle diseases. Hypertension is one of them. So there are amazing stories of, complete reversal of disease, right, or de-prescription, but it requires monitoring, like Dr. Kavitha said. So I think these point of care devices, these technology platforms enable that we are able to monitor. It's not that like today I was normal, I stopped taking medicine, and then I did not monitor my BP, because it could be that in the background it may still start building up again, right? So if we have these, then of course, with the support of these devices, the support of this ecosystem, right, we can certainly see that, yes, we are able to support to help you manage your disease or reverse your disease, right? Yeah. Not all claims, but I think certainly these things can facilitate. Question from
Yeah,
Konglesh.
especially Anshul, if
Yeah,
just adding, young person with hypertension, I think follow-up monitoring is very essential, Anshul. Because as I said in my talk, hypertension doesn't give any signs or symptoms whatsoever. So follow-up and monitoring is very essential.
Great. So we have two more questions. One again from Anshul, that this device works for all the members of the family, or do you need to buy a separate device for an individual? So see that this device works for any member of the family. Once you subscribe or take this, then it can work. You need the technology platform, but the care coordination then works for one person. But the device, of course, can be used to record ECGs for your family members as well. The question from Konglesh: Hi sir, my parents and grandparents are obese. My grandparents died due to heart attack. Sorry to hear that, Konglesh. Will that genetically pass on? So I'll probably allow Dr. Kavitha to answer, and then I can see if I
Sure.
need to add something.
Sure. Yeah. Hi, Konglesh. I think it's a very good question to ask, and others can also, get some knowledge on that. Looks like, there's some heredity causative factor here. There is some genetic predisposition. Your grandparent died due to a heart attack. That means to say there's a non-modifiable risk factor in the family, and chances of it to pass on genetically is there. So, so it's very important. The lifestyle modifications they have a double role in prevention of hypertension and heart diseases. So you need to doubly concentrate on the lifestyle modification. At the same time, now we have a test where you can detect, beforehand, getting your cardiac checkup done, getting your ECG regularly, monitoring your blood pressure on regular basis is very important at the same time on a long-term basis. So monitoring plays a very important role so that we identify it before it develops and help prevention of development of complications.
Great. I think we are almost on time, but I think it was a fantastic session. Thanks a lot, everyone, for joining, for your time. Thanks a lot, Dr. Kavitha, for a very educative session, and I think a very, very engaging Q&A. I would also like to thank Abhishek from AliveCore and the whole team who has supported us, right, from Shubhreet to Steffi from NanoHealth, to see that yes, we are able to have an impactful and effective session here. So thank you, everyone. Anything, Abhishek, you want to say as conclusion?
No, thank you so much, Dr. Rahul, Dr. Kavitha, and to the audience for this engaging session. And what we were chatting at the back end is we should do this maybe every week or at least every month.
Great.
Right.
Thank you, everyone. Thanks a lot.
Thank you.
Wish you all a very good health.
Thank you all.
Good health. Thank you.
Thanks a lot.
Thank you. Bye.